Hi, my name is Randall Clark. I'm with the St. John Clark Pain Treatment Center. This is a follow-up video from the one that we just talked about that had Ken Abraham's son talking about the reasons why eye muscles get tight and what actually moves our eye around. So just as a recap, there are 6 muscles up here that control the movements of the eye. There's a superior recti, an inferior recti, a lateral, medial, a superior oblique, and an inferior oblique. Now these all do all the different motions of the eye, whether they make us look up, make us look down, side, side. And these others up here actually rotate the eye, where the eye rotates back and forth like this. Now, these muscles, like any other muscle, can get tight, right? Just like your upper trapezius can get tight, or a muscle in your neck can get tight, your eye muscles can get tight. And like all these other muscles, these muscles can create pain. Now, there's a lot of people that complain of headaches behind their eyes and trouble when they're reading, sitting at their computer, doing things like that. Now, oftentimes things like what Ken told you about in the last video, where just some ergonomic stuff, things you can do so that you're not looking over the top of your glasses, or you have your laptop down on your lap and you're looking down at it all the time. Things like that you do repetitively that can cause strain in your eye. Just getting rid of those will help a lot of people. But if you have spasmed up your eye in such a way that just correcting those behaviors doesn't correct it, you may need to see a therapist who knows how to work on those. So what I want to show you is how we do at the clinic. When I explain to people that we're going to be working on their eyes, and I show them there are these eyes in the back behind their eyeball there, they sometimes get a little nervous, like, how are you going to get your finger to the back of my eyeball, right? And I typically tell them, no, I'm not going to use my finger, I'm going to use my elbow, right, and just drive it right now. I'm not going to use my elbow. We use Q-tips, right? We use these things here, and we use the eyelid to go back in. We won't actually be poking you in the eye or doing anything like that. So what I want to show you is kind of an example of what we'll be doing with the treatment. To show you that it's really not that scary and is very effective for people with vision issues or even chronic tension headaches. All right, so we have here Alex, one of the students at the Center for Neurosomatic Studies. He's volunteered to be our patient for today to show you what a treatment looks like. And we're just going to do a couple of these muscles and show you what it takes to treat muscles of the eye. So I'm going to have Alex here just look, we'll position his head like this. We'll have him look straight down, and I'm going to treat the superior recti, so that's the one on top. So we're going to go right on here on top of the eyelid, and while he's looking down, keep looking down there, Alex, we're going to come right back, and right there is where the muscle is. So if it's very tight, what we'll do is just hold on to that for a few seconds. How's that feel, Alex?
Feels good.
Not too bad?
No.
Okay. If it's not too tender, I'm going to do these little cross fiber strokes to work on the muscle. His isn't in too bad of a shape, so we can get right on out of there and do that. The next thing we would do is we go around and treat all 6 of these muscles. So we'll show you the inferior oblique as well. So go ahead and, inferior recti. Go ahead and look straight up. I'm going to come right in there. Any tenderness down there?
A little bit.
Little bit. Not too bad, so I'm going to pop right on out. It is common for the eyes to water as you do this, so nothing to be too concerned about. The reason, and I'll see if I can show this to you here, the reason why we have Alex look down or look up as we're treating this is as he looks down like this, what that does is it takes this top muscle and pulls it out this whole upper half where it's exposed and where we can get back and actually treat it. Now, we won't ever really treat all the way back to where it attaches back here near the optic nerve, but we can get the front half of that muscle, and usually that's enough to get it to release. These muscles have a lot of circulation to them, so they release very fast, but can be very tender the first time you treat them. So if you're having any kind of vision issue, any issue with tension headaches, any tracking where one eye isn't tracking or following the other eye perfectly, you call it a lazy eye, something like that. These are techniques that can be used to provide a lot of relief for people that have those sorts of issues. And Alex here, he'll tell you that wasn't too scary, was it?
No.
No, that wasn't too bad. It sometimes looks worse than it is. When you get in there and treat it, people will tell me, oh, well, that wasn't nearly as bad as I thought it was. So don't be afraid to have your therapist go back in there, check those muscles for you. If they're not a problem, they won't hurt at all. If they are, you'll know we can release them, possibly give you some great results. Until next time, thank you very much.